you. Meathead Mark Thomas here with Dr. Steve Horwitz and Dr. Alan Manison. In our last episode, we touched on the standard pre-participation exam that student athletes get usually before they play a high school sport. And I'm actually told there may be more P's in there than just the two, but I'll leave that to you guys. You guys are like my two peas in a pod here. You guys are experts in this, and we kind of touched around what the standard physical exam looks like for student athletes. But towards the end of it, we started to get into things that you guys would like to see. So in part two here today, let's go a little bit deeper in the pre-participation exam. And Steve, I'll start with you. Tell me what you would like to see done for the student athletes.
I'm glad we're doing this because I guess maybe it's better that it's in the second part, but there's a lot of disagreement in the medical world about getting an ECG, electrocardiogram of the heart. Is that necessary before your child plays sports? And it really depends on who you talk to. So here's one great example of something that's very serious. I'll go back to the history form. Why is that so important for you as a parent to fill out? Because if there really is a history of heart disease in your family, for instance, did anybody die under 50 years old, 50 or under, from any kind of heart condition? If that answer is honestly yes, you need to dig deeper. Is that even being done? So before we get to kind of the other things that are more musculoskeletal, I'll say, that's a monster one. Again, I mentioned about our son being adopted. With all we know is there might have been some family history of heart disease on the father's side. At 10, as he started to get a little bit interested in sports, boom, time for an ECG with the pediatrician, who was a D1 athlete himself. So I lucked out, he's a friend. So we did the right thing. So it's really important. So what are the three biggest causes of death in youth sports? Sudden cardiac arrest, number one, heat, number two, head injury, brain injury, number three. So why wouldn't I want to check those things out? If there's a history of a prior heat condition, my kid has problems in the heat, maybe you better look into kidney function, get better blood testing or any blood testing before your kid plays sports. And prior history of concussion, please answer that honestly. So we as the healthcare provider can make an honest assessment, or I can refer them to a neurophysiologist or neuropsychologist. I'm sorry, neurophysiologist, neuropsychologist, but neuropsych is the profession. So why wouldn't I want to refer an athlete to the highest trained person in that area if you're honest with me? So let's start with those things.
So Steve, you mentioned you were fortunate that your pediatrician was a former Division I athlete. Not everybody's so lucky. So right. Is it the pediatrician that should be the first person, that we go to, because you do have a relationship with them and they know your family history typically?
Hope so. These days, does the doctor really know the patient? I guess it depends on the practice. So you just got to find a doc that knows about this. It can be tough. Yes, did I meet somebody? But again, I'm a parent of an athlete, so I made it my business to meet somebody. Could I do that on my own? Yeah, but it's better to have multiple eyes on it.
Yeah, truth be told, a lot of these doctors are, juggling, 2,000 cases, at any given time. So, we like to think that, they're really concerned with us, but they got a lot of other things going on too. So that's not always.
Let's pay attention as parents, do our due diligence as parents, answer those questions as parents, maybe do a little research. As when we go into the doctor, we can be more educated. And if your doctor dismisses you or says, my degree is better than your Google search, well, then find a new doctor.
Right. Alan, your thoughts?
No, I totally agree. I think you're saying like doctors have 2,000 patients and pediatric practices are rotating doctors around. Ordinarily, in the case of something like, when you're looking at just a normal triage issue, even, if it's a heart, a brain, a lung, something that's kind of important, it should be taken seriously. And the parents, as it is with musculoskeletal injuries, as it is with so many aspects of sport and coaching, they need to advocate for the child. I have parents sometimes that come in and with their athlete and they say, well, it's a particular injury and, I'm a little afraid to say something and I don't want my kid to be benched or I want them to be able to participate. And I'm thinking, 1% of high school athletes under that go pro. We have to really look at our kids and say, what's the anticipation? What are the expectations of sport? We want them to have a good activity. We want them to be competitive. We want them to take that competitive nature, get on the field with it. We want them to be healthy and everything else. But we need to treat the kids also like they're kids. And there's a life after sport. So they might go through middle school, high school, even college and play in college. But what happens after that? Do you want them to have certain musculoskeletal injuries or say, we're going to lie on a form about a concussion or maybe there's a heart or not, they have a heart attack. It's really, as Steve has alluded to a few times, he said it like outright, the parents have to speak up. They have to say, hey, listen, little Johnny here, or little Nancy had, whatever, or, heart was beating funny, or, they can't just say, poo-poo it and let it go. You'll be fine. Just keep running or whatever. The patients have to advocate and go to the doctors and get the appropriate test. And I know, look, I have 3 girls that play high level soccer. I know it's a headache. I understand. I hear from all my patients with kids. I have to get an MRI. I have to get, the heart assessed. I have to make sure, there's breathing issues. So we get the lungs assessed. It's always like a headache and an inconvenience, but uncertainty is a great killer and it destroys a lot. We always want to know what a problem is versus not knowing what it is and guessing through, then having a bigger complication later. And that's why, Steve's saying, I'm saying it's like broadly, not even as specific on the 3 main topics he was talking about for the most common sports injuries, but with everything we see in office, it's really, advocate, go, don't be embarrassed. The parents have to open their mouths, be strong. Don't feel like, your provider's not going to listen to you or a coach is going to bench your kid or whatever. There's a lot of life after youth sports. And we need to protect our kids and make sure that they're healthy all the way through, no matter what they're doing.
So the standard physical is going to be almost like an assembly line, process because they have so many kids coming through and they got to knock them out and they got to get them done. You're going to get the stethoscope. They're probably going to look in your ears. They're going to check your blood pressure, pulse, the basics like that. If you were to give us a few examples of other things you would want done, what would they be? Would it be blood work? Would it be, I don't know, EKG? What else are we talking about?
So that's what I mean. The quote, serious stuff. That's why reviewing that history form. And then do you want to get the electrocardiogram or not? That's not a required part of the standard pre-participation physical exam in the United States. In other countries, it is. So you have to decide. So that's what I consider the serious stuff because that can kill you. So you really do want to do your due diligence there and see, do you need that or do you not? But now we're talking about the other assessments. So give you a good example. Is your athlete loose jointed or are they very tight? So there's no such thing as double jointed. Either there's laxity in those ligaments. So ligaments is that structure that runs from bone to bone. So is there a little bit of laxity or are they really, really tight? Great example. My son, he's now 6'2", 190. He's a big kid. He just turned 17. He, as a boy, was kind of lax ligament. So we had to start. So clearly I know that kind of stuff. So pretty easy for me to notice like, wow, as he's getting into football in 8th grade, and remember, this is Texas, so everything's bigger in Texas, including the weights the kids are supposed to push. So I don't want my son loaded. And I'm a competitive power lifter and I hold state records. So I love heavy weights. So let's get that on the table straight away. I'm not saying be a mamby-pamby. I love heavy weights, but I have no patience for heavy weights on a system or a body that's not able to handle the heavy weights. So we have to notice that and say, what's the plan here? And that's a whole nother, discussion about what do I do with a kid that's a little loose jointed? And what do I do with a kid that's a little tight jointed? So am I dealing with more of a mobility issue with this child Am I dealing with a stability issue with my son? Am I dealing with a little bit of both? I mean, most of the time it's going to be a little bit of both, but I have to be able to notice that. And is your doctor, athletic trainer, nurse practitioner, whomever, are they going to notice that kind of thing? There's something called your Baton score, which is a bunch of movements like straighten out your arm. Does your elbow bend kind of backwards? Straighten your knees. Do your knees kind of bend backwards? Can you take your thumb and pull it and touch your forearm? Can you take your pinky and it goes straight up in the air? And can you bend over and touch your toes? There it is. There's the Baton score, right? We had 4 tests that are on both sides of the body. So that's 8 points, plus bending over to touch your toes or palms to the floor. That's 9 points. If you're a 9 out of 9, you have some hypermobility. Is anybody doing a Baton score, especially on girls? It takes 1 minute, 1 minute to do it. Why isn't that being done? That can save a kid so much grief. Because if I notice that the child has lax ligaments, well, that's an ACL waiting to happen, unless I teach him stability. So is my son an ACL waiting to happen? Not anymore. Not anymore. Right? But if I left it alone, 100% he would be. So
that brings up another really important point here when we're looking at this is when we're done with the forms, when they're done with the two pages, it doesn't seem like they tend to translate to the gym because they're not doing enough of an assessment. So they could say this athlete has, they're maybe on the EDS or Ellis Downs or the Baton score. So it shows like a little more than laxity. It could be on a slight spectrum genetically, but minimal, not a big deal. But then they go in the gym and with their other high school buddies, and they all do the same stuff. And the trainers are just looking at the athletes as all being the same. There's no individuality. So if you're going to run this exam and run any type of musculoskeletal assessment, then obviously the treatment that follows, the training, especially in the gym, because every athlete, and Steve, correct me if I'm wrong, every athlete needs to weight train. Every athlete needs to get stronger. There's no downside. I don't care if you're a runner, a sprinter, distance, any sport, soccer, anything, weight training is vital. But anyway, I don't think that there's any individuality in definitely not the high school gyms, but even I think into the colleges. They're not even into the pros unless they go and they get their own person to work with them. So even if we were to add, which we want to do, different tests for different athletes of sports, then you get this data pool, and then what are they going to do with it? Do these schools or the clubs don't even do this, and they all should. They need to put the money into it and do it to protect their athletes. But who's going to take care of this afterward? Like, who's going to look after this and actually make sure that athlete, number one, performs at an optimal level, but by doing so, they stay safer, which is really the whole key to the sport, is playing at an optimal level, not just running them into the ground and guessing what they need to do.
So let me ask you this, the hypermobility test, is that something a typical pediatrician is going to be capable of doing?
I literally just stick out your arms, your elbows bend back, straighten your knees bend back, thumb to forearm, pinky, bend over, touch there it is. Any parent could do that. Just type in hypermobility score into any search engine. You'll come to plenty of videos. So this is what I mean about parents starting to become a little bit more knowledgeable. Parents need to go to the gym with their kids the first time, see what's going on. So, like for the little kids, what I like to see added, well, your little kid's 6, you're taking them to whatever the sport. Can your kid hop? Can your kid hop 5 times on their right leg and 5 times on their left leg? And is it fairly close to each other? And then, maybe they get a little older and they have to hop on the right leg to the right, and on the right leg to the left, and on the left leg to the right, and on the left leg to the left. Think about that one, right? And you'll see, oh my God, that's why my kid can't cut left. And you see how all these injuries can occur. And we're not doing the most basic assessments, for the girls. Just have your kid jump up and down and put your phone on slow-mo. Do their knees completely cave every time they land and take off, right? Cave together and kiss. Some of the most simple things that any parent can do. And I think that has to be part of an assessment. And then I have to put together, what am I finding about the athlete? What am I finding out about the athlete? And what are the requirements of the sport? And then if you go to somebody like Alan, if you go to somebody like me, we can put that together and go, I know what to assess now on your kid. I know about
Yeah, I mean,
your child specifically. I know about baseball, for instance, or volleyball, whatever the sport. Now we can dig a little bit deeper.
So
yeah, I mean,
let's say my
I'm
kid.
just gonna let me just on that topic of the knees and the jumping, something even as basically like a level one, and I think we're going to put together Don't Be Meathead for Home for Parents ACL assessment because no one's doing it. No one in the schools are doing it. They're not even doing it with different doctor visits and whatnot. If we can show parents how to identify if a knee is unstable, at least they know, hey, my child has an unstable knee. How do I know? Well, I follow these different tests, which athletic trainers, sports chiros, PTs, some orthopedists, they should, or most all orthopedists should know this. At least it's been identified, and then they can say, we have to do something about it. But even something as simple, I'll go even easier, is closing your eyes and stepping forward with one leg and watch what happens.
Yeah.
Mhm.
And if the knee buckles, you're in a cutting sport. If you're playing field hockey, you're playing lacrosse, you're playing football, you're playing soccer, you are going to be cutting back and forth. If you can't put your foot down without your knee buckling, you are looking at an ACL injury at a minimum. And guess what? Most all of them can be prevented, but someone's got to be doing these screens, and they're not in the pre-participation, exam right now at that level. And no one in their office, you don't take your kid to the pediatrician and say, let's take you through an ACL screen. It's not happening. High schools aren't doing it either. The information's out there. You take classes, everyone looks up at the screen, writes down their notes, but it needs to be done on a regular basis for all club athletes for sure. And it should be added to the PPP. And I think that's something at Don't Be Meathead that Steve and I will probably put together and make that available for everyone to tack on. And I think it should hopefully spread like wildfire. And every parent should be doing this on their own to assess if there's an imbalance and an instability. And then, what do you do from there? From there, that's the question. Steve, what do you think you do from there? Go see you or me immediately, or we can give them exercises to do to at least start rectifying the imbalance.
So that was my question, was going to be, okay, I've been screened. I see that I'm hypermobile, or I see that, I'm susceptible to an ACL. What's my next step? How do I find a person that's going to help me or help my kid?
Well, if we found it, hopefully we can tell you where to go. And that's what we love to see is, within your own community, it could be a person with no formal training that's just really amazing with athletes. And it could be somebody with every degree after their name, but are you good at assessing, and then are you good at fixing it? So just sending your kid to that right person, how do you find them? It's going to be somebody that I would refer to, or Alan would refer to, or we might do it. I like doing that. Everything is much slowed down for me at this stage of my career. I like doing that. I just did a pre-participation exam on a volleyball, a young boy, and he did have laxity, and he's going to be crazy tall, like 6'8" is what they're forecasting for this boy. And the mom's, like 6'1". And there's an orthopedic test, or several of them, that you feel the laxity of the knee. Why can't I show the mom that? So I showed the mom that. So she did it, and she goes, oh, wow, I see what you mean. That's why I don't like the whole stay in your lane stuff, because it took me 2 seconds to show this mom, and it took our 2 seconds to go, oh my God, I actually feel that. Why shouldn't the parent be knowledgeable about that? I think doctors are just scared to have smart patients. I love smart patients.
Yeah, we really do want the parents and the athletes. I'm involved in youth sports, so Steve, Mark, you are too, and obviously your wife works with the high level Division I athletes. It's great if the athlete and the parents can take care of things on their own and only need you if they really need you. When they come in with the kind of the early level mundane things, they're basic, easy to treat and stuff, it's like, these are easy. We want to get exercises out. We want to teach people how to do these things. And most things can be done at home. It's not just a question of a smart patient. It's someone who has the knowledge base and is looking for it and is constantly learning how to not only see, there's a little bit of instability, but what were those exercises they said to do, or what type of provider should I see, or there's a certain type of trainer they like. What is it? FM something. We want to make sure that the resources are out there for the athlete and the parents, and they use them a lot.
Good stuff. Good stuff. I think, we all want to prevent problems before they ever start. So we want people healthy. We want people injury free. Can't guarantee that, but we certainly want to have the best chance possible for that outcome. So anything you guys want to add before we hit the road here?
I think that's probably enough. Just try to make it a team. The child is the most important. So try to make it their team sports, right? Some are individual, but they're on a team. Try to make it a team. So you're working with the providers and the coaches and the strength and conditioning coaches and the sprint coaches. Try to make it a team.
And Mark, you know how I work up here in Maryland because I love Vic over at Kinetic, and I work with Brendan, the PT over there, and all the trainers, and the work I do, and I work with Kara. So, Steve's saying, like, we really do live. We're not just saying that. What Steve's saying, what I'm saying. We don't just say it. We are doing it. We work with a team with our patients to address their issues on all levels, and that is really necessary. And don't miss anything for yourself, for your youth athlete. It's so important.
And by the way, it's online, Alan.
Segue. Just to finish up, Steve, are you in agreement with me? Let's put together an ACL screen for parents to use for youth athletes. You up for that?
Absolutely.
Yep. All right, Mark, we're going to do that.
Alan, tell the people where they can find you online.
Sure. Find us on YouTube, see all our videos, everything we're talking about. Find us, on X, we're there, on Facebook, like us on there. And join our community and tell us things that you want to hear about, and we'll talk about it. We'll write about it. We've got Mark, we got Steve, Dr. Horwitz. There's me. There's Kara, our sports nutritionist. We have Vic, who's our FMS trainer. We're here to help all of you guys. Help us help you. That's really my message.
All right, we'll see you next time. And remember, don't be a meathead.
Exactly. Thank you, Mark.
Thank you.
Thank you, Steve.